In most cases, patients with ovarian cancer will be diagnosed in advanced disease. What means there are still implants or metastases outside the pelvic organs with bowel involvement, with the symptom of bowel obstruction and abdominal discomfort based on ascites, based on the pressure on the bladder, and with pleural effusion if the diaphragm, for instance, is involved. The treatment in ovarian cancer includes three items, three elements: surgery with the goal of complete resection of all visible diseases during surgery. The second element is the subsequent chemotherapy, in general 6 cycles of a combination every 3 weeks, and then followed by a maintenance treatment including PARP inhibition, targeting the repair mechanism. And based on this, all elements will influence quality of life significantly. And that's the reason why we have to try our best to improve and to preserve quality of life issues at the time of diagnosis, pain management, for instance, to deal with anemia, to deal with disturbances on the electrolytes, and to try to preserve the muscle activity using prehabilitation active training programs before surgery, the so-called prehabilitation. And the same for the time before chemotherapy and even the time to continue with the maintenance approach. And quality of life means all three elements: socially, physically, and cognitive. And that's the reason why we have to support the patient to communicate with herself including, for instance, creative therapies, creative writing, painting, and all the things. Giving her support by psycho-oncologists with professional approaches, and to help to communicate with the partners, with the relatives. And that's what can strengthen the patient and to support, besides education information, for the management of advanced ovarian cancer.
What happened in my life after ovarian cancer treatment? Well, everything. The complete life was very much disturbed and confusing. The new body situation was disturbing. Sexual life is still disturbing. Family life as well. And the financial situation changed too, as it takes some time to get full back in work. The side of life changed. Things which are important changed, and as well that life is limited and that you need a permanent and a very regular check-up with your doctors. The level of anxiety changed, and the focus on my own perception and on that what I wanted to reach in my last period of life.
First of all, ovarian cancer is, despite the fact that most patients have advanced diseases, curable. So cure is one of the most relevant goals in ovarian cancer. Nevertheless, even in relapse ovarian cancer, long-term survival is possible. And that's the reason why we improved the surgery, the chemotherapy, and the maintenance treatment as a so-called target therapy approach to make this disease with acute symptoms to much more a chronic disease. And that's the reason why the three items, strategy, including maintenance approach, until time of progression, is a treatment approach. And I'm really proud to know patients, even in the relapse ovarian cancer, they have 6, 7, 8, 9, 10 years, no relapses. And that's the target, to make ovarian cancer to a chronic disease.
I see a chronic condition as a condition which needs permanent observation and reflection. It means living with an illness which might be stronger than myself, And therefore I need a good team and a good network of different helpers, such as doctors, support groups, family, and others who are at my side and strengthen me to reach the best quality of my life in this period. But the handling of a chronic situation is very much demanding, as well as for my body and for my soul, also for my surroundings, like my family, friends, and doctors as well.
Everybody want to live long and good. And quality of life is, at the end of the day, the question how you are. And a sum of how is the current situation and what is your individual goal, your target. And that's the reason that we have to bring all our medical and non-medical intervention to this scope. Cure, long-term survival, and quality of life, to be active, to be empowered, and to be integrated in the daily activity. That is quality of life.
The most challenging issue in my life is not to overreact or to control my condition too much. It is important to me to handle my anxieties on a very good level, so that I can relax and lead a more or less normal life. This is not always easy and very challenging sometimes, because mood is changing every now and then and depends as well as people, work or doctors, and the day condition influences my day.
We did several studies on patients and we have asked them, what is quality of life for you personally? And at the end of the day, they want to reach their individual goals and to be interactive with their family, with their daily work, professionally, at their business, but even in their private environment, family, partnership. And that's the reason that if we talk about quality of life, we have to understand it's a dynamic process. We have to individualize the targets to know what are the resilience factors, what is for you personally important, and to bring this into the goal of any treatment decision. And that is quality of life from the patient's perspective.
To me, it means having a quite normal life, enjoying life with my family and friends and animals in the nature or somewhere. But it means also having trust again in myself, in my body, or in my psychological situation, or in my doctors, who play still a very important role in my life because I still have regular checkups every now and then. Quality of life means for me having no treatment as long as possible.
As a classical doctor, you are trained to cure patients. That's good, but not enough. Even quality of life issues are very important from the patient's perspective. But to know the patient's perspectives, you have to talk with your patients and to ask their history, their stories, their expectations and preferences. And as a doctor, you cannot define quality of life for the patients, but you can address quality of life issues in your treatment decision-making process. So ask your patient and listen to them.
They can be on my side when I need them. They can give me important information to handle my illness, as well as to accompany me during my difficult situations. If I have the feeling I can trust and contact my doctor whenever I have an urgent need, I have a very high level of quality of life. But it is also important that my doctor is well trained, for example, in communication. and he does research on ovarian cancer. I would be very impressed and at the same time very relaxed if I would have such a doctor on my side.